And I can't afford to look like an amateur, so I always work the patient with the eyes wide open. As you get used to working the patient with the eyes wide open, the most adroit operators and the most adept operators in America will tell you that they prefer the eye open state. Many people, even when you tell them to open their eyes, they'll close them again and go right back in. You'll also notice that when you get this deep state, there isn't the tendency to come out of it that you have in the light state. Remember, it was only a few weeks ago that you people were saying, well, how do you keep minute? How do you keep minute? You no longer have to worry about that. Once you get the deep state, very seldom will they come out of it. And they'll only come out of it if something happens which frightens them. If fear, or if you give them the wrong kind of a suggestion. You say, and that hurt, didn't it? And brother, they'll come right up out of the hypnosis. Don't do that. In other words, you know your proper semantics by this time. You've been getting quite a training in the right kind of semantics. Do not confuse this state with waking hypnosis. It is separate and distinct. Now remember, so that there's no possibility of confusion, let's see that you understand what a post-hypnotic suggestion is. A post-hypnotic suggestion is one given while the patient is in hypnosis to take effect after the patient is roused from the state. You have been working with post-hypnotic suggestions since your first lesson. Because when you give a health suggestion, that's a post-hypnotic suggestion. When I have you open your eyes, you're going to feel better than you felt all day. What is that but a post-hypnotic? Constantly, you have been working with post-hypnotic suggestions applied towards medicine. If I have contributed anything to hypnosis, it is the fact that I have been able to translate what the stage operator does into terms of medical usage. And that perhaps has been the greatest contribution that I have made, because the stage operator, in hypnotizing hundreds of thousands of people, has learned far more about hypnosis than the doctor, because the doctor works with 10, 15, 20 patients a week, perhaps, maybe 30, 40 patients if he's using hypnosis almost routinely. But the stage operator hypnotizes tens of thousands a year, and he learns how to use hypnosis so intelligently. So, if you can translate what the stage operator does into terms of what the doctor in his office does, or at the hospital does, then I think you're doing something pretty valuable. This technique offers doctors many advantages. The patient can cooperate more fully with the doctor, pointing out troublesome areas and so forth. I'm talking about the eyes wide open state. The ophthalmologist needs the state, for he works completely with the human eyes, and the fact that the eyes can be kept open while the patient remains in deep somnambulism makes this the much preferred state for him. Other medical and dental men find the state to be advantageous according to their requirements. Working with a patient while his eyes are wide open offers another great advantage. To those who know the subject of hypnosis, the man who treats his patients in this state is looked upon as a skillful practitioner. With proper hypnotic technique, the patient has no knowledge of any kind that hypnosis has been used. If questioned, he will usually say, how could I have been hypnotized? I was wide awake and watched the doctor's entire treatment. It's so fallacious. You're always wide awake in hypnosis. You're never asleep. But people will say that to you again and again and again. I think we've covered everything that I want to cover this session. You know how to compound, and you know the steps necessary in compounding suggestions. They're all in your outline. Now tonight, you're going to get, each one of you, in addition to the outline, you're going to get a bibliography of recommended books. These books on the bibliography are hard to find. That is, some of them are. But every book on that bibliography is worth reading. Why isn't it a long, lengthy bibliography like you find at the seminar and these symposiums? Because we're not in the business of selling books. If a book hasn't personally met with my recommendations, if I can't conscientiously back it up and say, look, maybe there are mistakes in these books, but these men were honest writers. At least they knew about hypnosis when they wrote about it. What books will you find on my bibliography? Books that are known today and respected through the length and breadth of medicine and outside of medicine. Bernheim's Suggestive Therapeutics. Oh, you can buy a copy of that, because that is the greatest book that has ever been written on the subject of suggestion. And even today, many of the things that he wrote about hypnosis have still to be tested and found true according to what Bernheim was doing with hypnosis. Few doctors today will ever get to be the operators that Bernheim was, and Bernheim wrote truthfully about what he did with hypnosis. Now, remember, at that time they did not know about hypnosis what we know about it today. So if a man made mistakes, they were honest mistakes. It was like expecting a man to write about filtration before they knew that water had germs in it. You know, you've got to think of things like that when you read a book like that. That book was written about 1880, 1890. It was in that period. The next great book that is on that bibliography is Suggestive Therapeutics by Henry Monroe. Anyone fortunate enough to obtain a copy of that book is indeed fortunate, for it is a great piece of writing. It's much better in the final analysis than Bernheim's book. But remember, Monroe was 50, 75 years ahead of his time. Bernheim was of his day. Monroe was so far ahead that recently, when some doctor told me how his son had happened to locate a copy of Bernheim's book, and he read the book, he came to me and he says, you know, Dave, a lot of that you're teaching is in Monroe's book. Well, of course a lot that I'm teaching is in Monroe's book, but why aren't the others teaching it? The same book is available to them. Another great book on there, I think we've got The Human Mind by Menninger. I think that Carl Menninger wrote one of the greatest documents that has ever been written. Menninger's book, The Human Mind, is not about hypnosis, but it will tell you how the human mind reacts so that you know that when you use hypnosis, what to expect in the way of human reaction. So for that reason, it is vital, required reading if you're going to be adept at hypnosis. Now, here's a man with whom I haven't always agreed, but that he wrote a great book, Psychosomatic Gynecology by Kroger and Freed. I think it's one of the greatest books ever written, and while you may be in dentistry, nevertheless, you can learn a great deal from that book, Psychosomatic Gynecology. It has the name gynecology, but believe me, so far as it being helpful to the man who is not of that profession, oh yes, indeed, indeed it is helpful. One of the greatest books I have ever read is by a man named Baudouin, Suggestion and Autosuggestion, published in London by George Allen and Unwin Limited. Baudouin, for the first half of his book, has written a great piece of literature. The last half of his book, he goes haywire. So if you just read half of it, and when he starts to go haywire, you know where he goes haywire. It's just like this man Braid that you hear me tell about. Braid was a respected English physician, and he was the man who discovered hypnosis, that has discovered it the way we know it in terms of today. Braid got interested in phrenology, bumps on the head. And you know, hypnosis, when it first began, was such a pseudoscience. People didn't know where hypnosis left off and phrenology began, so Braid got all mixed up in other things. One of the things we have tried so hard to do is to stay away from all bias and prejudice and pseudosciences and present hypnosis as a scientific subject. Therefore, when you read a book by a man like Baudouin, who up to a point did a magnificent job with hypnosis and then got sidetracked by something else. It's too bad that the last half of that book isn't as good as the first half. A very good book to read is Modern Hypnosis by Kuhn Russo, two writers who did an awfully nice job. And then I think that everyone should read The Will to Live by Hutschnecker, published by Crowell originally, and I think it's now published by Random House. Random House took it over and put out a reissue or another edition or something, and are doing a very nice job with it. I think it's about a $10 book today. It should be, and it should be required reading for every person who is a suicidal depressive or anything like that. And it should be required reading for every doctor in the world. Now, in addition to the bibliography, there is in each bunch of stuff two records, two of our relaxation records. These relaxation records most of you have heard about already. If you haven't, these are the records which have hit the wires about 5 different times, for women have delivered painlessly just listening to those records. These are the records. The last picture I got with a write-up showed a man holding his pants out, way out like that, loses 75 pounds by listening to phonograph records. These are the records. These can assist in so many ways. Now, how are they meant They aren't meant for you. They are meant for your patients. They are meant for those patients whom you try to get into the relaxed state and they won't lose the numbers. And if they take that record home, I assure you that when they come back in a week or so, chances are you'll be able to get them into a deep hypnotic state. Now, these records are particularly clever for one thing. We thought of it this way and planned it this way, and it has worked out beautifully. Sometimes, you know, the best laid plans of mice and men gang after glee, but sometimes they work out all right. When we made these records, we wanted them as records that the dentist could give out to his tough patient, the physician could give out to his tough patient, but that they wouldn't hypnotize anybody, because I didn't want the doctors giving out a record and then somebody saying, you hypnotized me while I was home. So these records only contain the same material as a safety match contains. If the doctor isn't there to bring the match and the match cover together, you don't have all the elements that constitute hypnosis. The important element which constitutes hypnosis is left out of that record, intentionally. And here's what it is. The record bypasses the critical factor but has no selective thinking in it. Therefore, here's what you will find. Since it has no selective thinking, you'll find people that'll take that record home and will tell you, people who have difficulty falling asleep, you know, I never have heard all of that record. I just start playing it, and next thing I know, it's morning, and the record's still going, but I haven't heard any of it. They fall asleep listening to the record. I want you to know that this happens and why it happens. That couldn't happen if it achieved hypnosis, because nobody can fall asleep in hypnosis. That's a different thing entirely. But this record will let you fall asleep. Now, the record has been imitated. The record has been imitated to such an extent that I'll tell you what happened in Kansas City. I go up to the hotel desk to register in one day. We stop at the President Hotel there, and we have our classes there. And the clerk behind the desk said, Mr. Ellman, there's a doctor here who wants to buy a dozen of your records that you put out. Do you put out records? I said, yes. He says, he wants to buy a dozen of your records. This person is not a student of yours, but he's used those imitation records that have been made of your records, he says, and he doesn't get nearly the effect that is obtained by your doctors with these records. Well, anyhow, I wouldn't let anybody but my students have these records. Right at the present time, you can go into any music store in America and order a set of records called Relax, imitations of the Dave Ellman records. You can go to other courses, you can find imitation records. But they don't know how to leave out the selective thinking. They don't know how to just put in half the hypnosis instead of all of it. And so the records, I don't think, are nearly as effective as these. But these are the records which you have read about in your papers when you've heard a woman gives birth to baby, listen to a phonograph record. This is the one it's talking about. So pass out those records, and remember, they're to be used by your patients, not by you. Although those of you who find it difficult to learn autosuggestion can learn autosuggestion by listening to those records. Friends, your doctors have brought you here for a very important purpose, so that you can have your baby without feeling a thing. So that you can have your baby the way the woman on the pages of Life magazine had her baby. So that you can have your baby with a great big smile. So that you do not feel any of the discomforts of delivery. So that you just have a wonderful experience out of delivery instead of a horrible ordeal. Now, if you regard this as a joke, look at the number of women beside you and think of the number of doctors who have brought these people here. They wouldn't have brought you here if they didn't know that this is possible for you to have. Now, what will prevent your having a painless delivery despite all the work that we do here with you tonight? Only one thing. A thing called fear. Now, it can be the tiniest of fears, and yet it can prevent a doctor from achieving what he wants at the time of delivery. Now, let me tell you what I mean by that. You'll be conditioned tonight, but comes time for delivery, and you're at the hospital, and you're saying to yourself, oh, gee, I wonder if the babysitter knows what to feed the baby tonight. Oh, I didn't tell her, and I don't know if I had that food stuff in the refrigerator. And you're worrying about how another baby is getting along and how the babysitter is going to treat your baby, your other baby, will keep you from getting this state. Or it could be a little thing like, gee, I wonder how we're going to pay all the bills. That also can do it. In other words, what you must know is that at the time of delivery, you must be absolutely free of fear if you want tonight's work to be effective. It broke my heart in Wichita last year, and this is Wichita again today. We conditioned 37 women. Every one of those women could have had their babies painlessly. But I got reports that they let fear get into them, some of them, and so we didn't have perfect results with 37. We should have perfect results with every person who is in this room, providing you keep fear out. Now, last year we did not accent fear as we're doing now, but we know from a serious study of our case histories that the doctor runs into some very odd situations. You can have bitter words with your husband just before you go into your first contraction. That can keep you from having a painless delivery. Any thoughts on your mind that are unpleasant or filled with fear can keep you from having this state. And so I warn you that there is one way in which you can make sure that you have an absolutely painless delivery after we get through working with you tonight, and that is by telling your doctor every little fear or anxiety that is on your mind. If you're worried about the gas bill, tell him. If you're worried about what Josie said to Mabel, tell him. If you're worried about those words that you had with your husband, or the fact that you're not getting along with your in-laws, or that your in-laws don't approve of you having so many babies, I want you to talk these things over with your doctor. He is the only one who can show you how needless those thoughts are at the time of delivery. And if you obey these instructions, ladies, I can tell you that our percentage of success is so high that we can assure you 100% success with every person in this room, providing fear is kept out. It's the only enemy of this state. Is there anyone in this room who won't get the state that we're working for tonight? I don't know. If you regard it as a joke, you won't have it. If you sit there in your seat and say no, you won't have it. But all you have to do is to follow instructions, and you will have it. And you'll have the state beautifully. Now, I hope your doctors haven't told you too much about what we're going to do tonight. We start our session by the playing of a phonograph record. All you have to do is to listen to the record, follow its instructions, and you'll be all right from that point on. Now, the first half of the record is really not intended for you. It is intended for the doctors. Now, let me tell you why we have to play it. This is a classroom, and you're attending a class. Therefore, in attending the class, you must hear what the doctors hear, instructions, how to handle a woman in a painless delivery. So, as you hear this phonograph record, just know you're not supposed to be hearing it. I'll venture to say that any of our old students probably won't let their patients hear the first half of this record. You're going to have to hear all of it because we have no way of keeping you from hearing it. But just know that if you follow the instructions when we get to the side of the record that you're supposed to hear, you'll have the state that we want. Now, after the playing of the record, follow instructions from then on, too. At the time that we play your half of the record, I want every one of you to get rid of the things that are in your hands. Get rid of the purses, put them on the floor, get rid of the ashtrays, get rid of everything. Nothing should be in your lap. Nothing should be in your mouth. If anybody is chewing gum, take the gum out of the mouth. That's only being done for one reason. An old performer told me many years ago, he says, if you want to divert attention from another person, all you have to do is to chew gum on stage, and you'll have every eye on you, and they'll forget all the other people in the room, just you. And I don't want the eyes of everyone on just you, so nobody chew gum. Well, that's about all, except now that we'll play the record. And please stop your tape recorders as we play the record.
The procedure on the opposite side of this record is the one I have talked to thousands of physicians who are using it successfully in their practices every day. Let me tell you something about medical relaxation. The words medical relaxation describe a state which has been misnamed for several hundred years. There has never been a good name found for the state which I teach doctors to obtain with their patients. We know that the state is one of deep relaxation. And it is so easy to obtain this deep relaxation if you approach the patient in the proper way. Approach your patient something like this. Mrs. Jones, well, if I could teach you how to relax, you realize that you could have your baby with an absolute minimum of pain, perhaps none at all, and Mrs. Jones is sure to say, well, doctor, teach me how to relax. And all you have to say is, I can teach you the medical way to relax if you will just follow my orders. In fact, I can teach it to you so very easily. I can have you sit down in that chair over there and just listen to a phonograph record. Now, all you have to do is to follow the instructions on the phonograph record, and you learn how to relax medically. Just by listening to a phonograph record, you can obtain as deep a state of medical relaxation as you want, and you can have your baby that way, and you will have that baby with an absolute minimum of discomfort. Well, then she wants to hear the record. So you tell her to sit down comfortably in a chair. Just sit down as comfortably as you can possibly sit down, and just stretch out and do exactly what the record tells you to do. And I'll listen to the record here with you. For if she follows the instructions, she will obtain that deep state of relaxation. Now suppose the record is played for about a minute or two, and you see that she's not following the instructions on the record. You stop the record, and you say to her, now, Mrs. Jones, this is up to you. If you want to have the benefit of relaxation, then you must learn how to relax properly. You've got to do what the record says. I want you to imagine that that's my voice on the record, that I'm talking to you, and you're just doing as I tell you. Do you think you could do that? And she'll probably say, yes, I think I could. And then you say, all right, now let's start this record over again. Do exactly as it tells you to do, and that's all you have to do. If you just follow the orders on that record, you'll find yourself feeling so good in a few minutes. Now, in a few minutes, if she follows the orders on the record, she begins to be medically relaxed, and the state is one of such grand euphoria that before long she is enjoying the state tremendously. As she enjoys the state, and because she enjoys it, she goes deeper into it as she follows further instructions. In a little while, she is in a deep state of medical relaxation. Now, there's another thing You must know about medical relaxation. It is not a state of unconsciousness. It is a state of keen consciousness. There is not dimmed awareness. There is increased awareness in the state of medical relaxation. Therefore, the patient hears the words which you say much more clearly, and they land so much more emphatically in her mind. Eliminate all words such as hurt and pain, because with the increased awareness which medical relaxation brings on, she hears those words so clearly, and they seem so important to her, that what would ordinarily cause her to tense and feel hurt or pain causes her to feel pain and hurt about 2,000% more if the wrong words are used. Therefore, stay away from all words that paint a picture of pain. For example, stay away from words such as knife, needle, sharp, incision, stitches, and so on. One of the most important things about obtaining the medically relaxed state is to have confidence when you do so. Confidence is the keynote of success. Believe it will happen, and it will happen. Start conditioning the patient at any time, even up to and including actual labor period. But of course, catching a woman in the midst of labor and conditioning her for a relaxed delivery must be done by those men who are expert in the field and know medical relaxation thoroughly. For the novice with a subject, it is best to begin when the woman first begins to show signs of pregnancy rejection. I'm talking now about the nausea and vomiting of pregnancy. Suppose a patient comes into your office who is showing those signs. A most amazing thing will happen if you tell her to just sit down and listen to this record. That if she will relax, that you can promise her, almost with certainty, that if she just listens to that record, her nausea and vomiting symptoms will entirely disappear, and she'll feel like she hasn't felt in months. She'll feel so good. She'll scarcely believe that will happen. Neither will you, probably. But when she sits down and listens to the record, an odd thing happens. When she relaxes, the way she is told to do on the opposite side of this record, we bypass the critical factor of her mind, and we establish selective thinking. The critical factor of the human mind is that part of your mind which tells you that hot is hot and cold is cold, and pain is pain and hurt is hurt. This critical factor is bypassed through various techniques used on the opposite side of this record. And suddenly we find that we are able to establish the type of thinking we want. That is, that there will be no vomiting, that there will be no nausea, and that she will feel wonderful when she opens her eyes again. All this will happen if she merely listens to the record. It is not only important that you have the patient listen to this record 2 or 3 times during her pregnancy, but it is also important that she practice relaxation at home. I would suggest that you have her listen to the record, say, every 2 months during the time of her pregnancy. Then give her one of the relaxation records to take home so that she can practice relaxation and learn auto-suggestion, so that she can give herself suggestions for the relief of any discomfort which she might have during the actual delivery. Now, as to what will happen in the delivery room. Be sure that you do not take the patient by surprise. Keep the patient apprised of what you are doing at every step of the road. Remember, she may have her eyes closed, but she is perfectly conscious and aware of every word you say. And so should a nurse come along and say, well, I don't understand it. She looks awfully relaxed while she's having those contractions, but you can't tell me she won't have some pain. And chances are the patient will begin to have pain. Therefore, you must warn your delivery room nurse that she is not to say a word that interferes with the semantics of medical relaxation. Suppose you are working with your patient in the delivery room now. She is thoroughly relaxed, but you begin to sense that she is feeling things. You can add your own words of nothing's going to bother, nothing's going to disturb. You're going to take those contractions so easily and they will be so pleasant. In other words, reinforce what you hear on the opposite side of this record.